Serotonin, also known as 5-hydroxytryptamine or 5-HT, is a chemical messenger, a neurotransmitter, and a hormone that plays a crucial role in both the brain and the body. While most people associate serotonin with mood, its influence goes far beyond just how we feel. Surprisingly, about 90 to 95% of the body's serotonin is found in the gastrointestinal tract. Only around 5 to 10% exist in the brain, but this small amount has a big impact on our behavior, mood, and mental health. Serotonin is also stored in blood platelets, where it's involved in clotting and vascular tone. Serotonin is synthesized from an amino acid called tryptophan in a two-step process. First, tryptophan is converted to 5-hydroxytryptophan. Then, it's transformed into serotonin by an enzyme called aromatic L-amino acid decarboxylase. It's important to note, serotonin cannot cross the blood-brain barrier, so the serotonin in the brain and in the body come from separate sources. Serotonin has many functions, including mood regulation. Serotonin stabilizes mood and emotions. Low levels are linked to depression, anxiety, and irritability. It helps regulate the sleep-wake cycle and is a precursor to melatonin, the hormone that promotes sleep. Serotonin controls bowel movements and gut motility. In the brain, it affects hunger, cravings, and fullness. It contributes to cognitive functions, including memory, learning, and emotional processing. It can affect libido, arousal, and orgasm. Too much serotonin may suppress sexual desire. Serotonin promotes vasoconstriction and plays a role in blood pressure regulation. It helps regulate body temperature. Serotonin in the gut can trigger nausea, which is why medications like ondansetron that block serotonin receptors are used to stop vomiting. In the blood, normal levels range from 101 to 283 nanograms per milliliter. In urine, around 2 to 6 milligrams per 24 hours is typical. In the cerebrospinal fluid, the range is 10 to 50 nanograms per milliliter, though this is rarely measured. Low serotonin may result from depression or anxiety, chronic stress, a poor diet, especially low in tryptophan, vitamin B6 or B3 deficiency, hormonal changes, such as during PMS or menopause, gut issues or microbiome imbalance. Symptoms of low serotonin include low mood or sadness, fatigue, poor sleep, irritability, cravings, especially for carbs, difficulty concentrating, low sex drive. Too much serotonin can also be dangerous. The most serious condition is serotonin syndrome, usually caused by combining medications that increase serotonin levels. Symptoms include agitation or confusion, muscle twitching or tremors, fever and sweating, rapid heart rate, diarrhea, in severe cases, coma or death. It can be triggered by combining drugs like SSRI, MAO inhibitors, tramadol, or MDMA. Treatment includes stopping the offending medication and sometimes using a serotonin-blocking drug called cyproheptadine. You can support healthy serotonin levels through eating tryptophan-rich foods like eggs, dairy, turkey, and nuts. Getting sunlight exposure, exercising regularly, practicing mindfulness and meditation, having positive social interactions, prioritizing quality sleep. Several drug classes influence serotonin levels. SSRI, like fluoxetine and sertraline. SNRI, like venlafaxine. Tricyclic antidepressants. MAO inhibitors. Antiemetics, such as ondansetron. Migraine medications, like triptans. And even recreational drugs, such as LSD and MDMA. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.